Hello, my name is Eva Feldman. I'm director of the Neural Network for Emerging Therapies. We're very interested in brain health as a major research area in the network. We're very pleased to tell you that we've received a grant from the National Institutes of Health, the Diabetes Division, to look at brain health in individuals with type 1 diabetes. Why type 1 diabetes? Well, type 1 diabetes is actually now very treatable with the use of insulin pumps and continuous glucose sensing. So it's important that individuals have a full quality of life that goes along with their clear increased longevity. But yet what is known is that individuals with type 1 diabetes can develop memory and thinking problems. About 80% indeed do that, compared to individuals without type 1 diabetes at the same age. Collaborating with colleagues in Melbourne, Australia, with the Murdoch Children's Research Institute and Monash University, we are going to examine individuals who 30 years ago were carefully looked at in terms of their IQ, their cognition, and actually had brain MRIs over a period of time of about 10 years from their type 1 diabetes diagnosis as they got older and into adolescence. Now they are adults 30 years later, and we're going to repeat that same testing and see how their memory and thinking has changed. And what we're also going to do is in the interval, understand what occurred to them during those 30 years in terms of their control of their blood sugar, control of their lipids, their blood pressure, and other medical parameters.
Hello, my name is Fergus Cameron. I'm a professor at the University of Melbourne and the director of the Department of Endocrinology and Diabetes at the Royal Children's Hospital, and one of the principal investigators of this study. As a paediatrician, we are very focused on developmental outcomes in children and adolescents and how chronic disease might impact on those developmental outcomes. And if you think about it, the most important developmental outcome in pediatrics is to grow a good brain. So any disease that could affect brain development is of critical interest, and diabetes is an exemplar condition of that because diabetes affects the main fuel of the brain in terms of blood glucose. And we have documented in this cohort of patients over the decades in a number of publications that there are impacts on the developing brain, and we're now looking at the same cohort are now in their middle adult lives.
My name's Elizabeth Northam, and I am a senior research fellow at the Murdoch Children's Research Institute. And my role in this study is as the study coordinator. And I started this longitudinal study 30 years ago as my original PhD topic. And it developed from my realization as a neuropsychologist that the brain runs on glucose, and glucose supply is often disrupted in children with diabetes.
Hi, my name is Richard Bear. I'm Associate Professor of Imaging and Bioinformatics at Monash Uni and Murdoch Children's Research Institute, and I'm responsible for analysing the MRI data from this study, and that means looking at relationships between measures from MRI and the clinical measures. We'll be using the brain MRI measures to test whether there are differences between diabetic patients and controls in the way their brain changes over time.
I'm Dr. Amy Brown. I work on the study as a research psychologist, and I help with the day-to-day running of the study. So I do all the assessments with the participants. So when a participant comes in for their cognitive testing, we do some specific tests of their memory and attention, as well as a measure of their overall general intelligence.
My name is Lily Zhao, and I'm a faculty in Biostatistic Department, University of Michigan. I have been working with many health-related projects, including this one about diabetes, type 1 diabetes. So we're trying to use rigorous statistics to ensure a very unbiased, reliable statistical analysis.
Multi-institutional collaboration is really important for this kind of work. It brings together experts from many different fields. So I'm an engineer with a background in image processing, with expert clinicians who have worked with developmental cohorts for a long time, and international experts like Professor Feldman to study these important problems.
So we're very excited to be able to understand what will allow some people with type 1 diabetes to remain having a healthy brain, while what factors will cause others to have a brain that is less healthy with memory and thinking problems. The acronym of our study is CLARiFY, which stands for the Cognitive and Longitudinal Assessments of Risk Factors individuals with type 1 diabetes for brain health.